So I just thought for the start of our presentation tonight, we would show you the latest updated immunisation schedule. So it is red and blue in colour. It's dated the 1st of July 2024 for just in case you're wondering. What I've done here is I've cut pages 2 and 3. So it shows you the adolescent and adult sections and the seasonal influenza information. So on your full schedule, these are pages basically 2 and 3. Also just popped in the specific Western Australian Aboriginal immunisation schedule, and same thing, it was produced on the 1st of July 2024, so it is the most current version, and it is the adolescent and adult and the seasonal influenza, so pages 2 and 3 again. So I'm going to talk this afternoon or this evening about our adult vaccinations. So beginning at around the age of 60, the human immune system undergoes some dramatic age-related changes which continually progress to a state of what's called, and I'm going to say this probably wrong, immunosenescence. The aging immune system loses the ability to protect against infections and cancers and fails to support appropriate wound healing. The body becomes less able to respond to infections and develop long-term immune memory. So immunosenescence plays a key role in the development of respiratory diseases that are more common in our older people, such as asthma, COPD, and respiratory infections in the elderly. And during this phase, vaccine responses are typically impaired. So as you can see by the little graphic on the side there, you've got a healthy immune system and how an antigen is injected, and you get a great antibody response. In immunosenescence, the response lags and you get diminished immunity from that. So the main objective of vaccination is the prevention of infection by specific pathogens. The direct impact of vaccination on the maintenance of homeostasis is achieved through the prevention of infection-induced complications. Other positive effects include enhancing the trained innate immune response by reprogramming innate cells in the body to respond more efficiently to threats from other pathogens, and slowing immunosenescence by altering the epigenetic clock and harnessing the pool of memory B and T cells to enhance responses to new infections. Okay, so vaccines in itself may exploit the plasticity of the immune system to drive longer-term immune responses that promote health at a broader level than just the prevention of single specific infections. Immune fitness or immune training involves establishing lifestyle habits that can improve our immune capacity. We now know that eating good foods, having good social relationships, not smoking, limiting our alcohol consumption, exercises, controlling stress levels, and establishing a correct vaccine program all have a really positive impact on the quality of our immune response. So vaccines can positively contribute to immune fitness in ways and mechanisms that are only now beginning to be understood, and therefore a life course of vaccination is fundamentally a good tool for achieving healthy aging. So on our current schedule, now I've included all the ones that are on the WA schedule. So if you are from over east, apologies, this is the WA schedule ones. And the top one I've put on there is our measles, mumps, rubella. Now that's the current recommendation for measles, mumps, rubella is actually 2 doses. The first MMR combination vaccine was introduced way back in 1969 before anybody on the screen was even born. And the second dose was recommended in November of 1992. So unfortunately, those on the screen that are around that age possibly only had one. So in 2003, adults born after 1965 were recommended to have that second dose of MMR to give them a 99% coverage. And it's thought that people that were born prior to 1965 will have some sort of natural immunity, as there's a high chance that they would have had measles when they were a child. So currently the MMR is funded for adults born after 1965 by our state government. Prior serology doesn't need to be completed. If someone presents and says they were born after 1965 and they don't believe they've had 2 vaccines, you are more than welcome to give it to them. And it's especially recommended before travelling overseas or becoming pregnant. Our second one is the influenza vaccine. Now, the flu vaccine is recommended yearly and is free to those over the age of 65 on the National Immunisation Program. It was also free for all adults during May and June of this year in WA. Annual vaccination is the most important way to prevent influenza and any of its complications, and it can be safely co-administered with most other vaccines. Pneumococcal. This is a tricky vaccine for us all. So infants and elderlies have the highest pneumococcal disease burden. Pneumococcal disease is disproportionately affecting our Aboriginal and Torres Strait Islander children and adults as well. Pneumococcal disease is more common in people with certain risk conditions, and the optimal pneumococcal vaccine program for Australia is currently under review, and the handbook chapter in the Australian Immunisation book has just been updated. So at present, we have the Prevnar 13 and the Pneumovax 23 as our funded vaccines under the National Immunisation Program for eligible people. The handbook also has recommendations, interim ones, for the use of extended valency vaccines, which is your 15 PCV, and your Prevnar 20. So that's Vacunescence and Vacunescence, I can never say that one, and Prevnar 20 in the populations for whom that they are recently have been registered for the Therapeutic Goods Administration, and that's all in the Australian handbook. These 2 vaccines, though, are not currently on our national immunisation program. Then we have Shingrix. So Shingrix is our zoster vaccine, and it replaced Zostavax on our national immunisation schedule in November of 2023. Shingles is a viral infection that causes a blistering, painful rash. It's caused by the reactivation of the same virus that caused chickenpox, and while most symptoms usually last only 2 to 3 weeks, shingles can become quite serious, and it can lead to some nerve pain that may last for months. Other serious complications include pneumonia, hearing problems, blindness, swelling of the brain. About 1 in 3 people will get shingles in their lifetime. It's a 2-dose schedule, with each dose being between 2 and 6 months apart. This vaccination is more reactogenic than the previous Zostavax, and the more common side effects include pain at the injection site, redness and swelling, tiredness, muscle aches, headaches, fever, and gastrointestinal symptoms. These reactions typically disappear within a few days, though. And then finally, on our current schedule, we do have the COVID-19 vaccination. So COVID is still affecting our community. Hundreds are still dying of COVID-19, especially our at-risk, vulnerable elderly population in aged care facilities. Recently, data was released that showed that there was 422 deaths in Australia from May to the end of July. And on any given week, approximately 2,000 people are affected, and that's just in the aged care facilities. So whilst we have some antiviral medication that can help, the best form of defence against COVID-19 is still the vaccination. And current ATAGI guidelines are recommending that adults over the age of 18 consider having a dose every 12 months, especially if they are travelling. And for those over 65, it's recommended that they have a booster every 12 months. And for people over 75, they should have a booster every 6 months. Severely immunocompromised people should consider having a dose every 6 months. A couple of extra vaccines that we should talk about that aren't on our schedule. Pertussis, so tetanus and pertussis, so we're talking Boostrix and Adacel. During adulthood, the waning immunity will make us more susceptible to illness, and in that we thought we've been in illnesses that we thought we'd been vaccinated against. Whooping cough has been making a resurgence in recent months, and in pockets of WA we've seen quite a substantial load of people getting whooping cough, and it's kids passing to adults and adults passing back to kids. So Adults aged 65 years and over are recommended to receive a DTPA dose if they have not had one in the past 10 years. And this is because pertussis is associated with increased morbidity in older people and the waning of the vaccine immunity during this time. The pertussis vaccine isn't standalone and can only be given with tetanus and diphtheria, and it can be co-administered with other vaccines. And we also have recently had put on in the handbook and on our radar is the RSV vaccination, Arexvy or Abrysvo. So we're all aware of the respiratory syncytial virus that causes upper and lower respiratory tract infections, and it can be more serious and more severe in the very young and the very older people. This year, the state government committed to immunising our young vulnerable babies with this Nirsevimab or Beyfortus, and this program is proving to have been a great success with lower hospitalisations of young babies for RSV. Just remembering, though, that the program is still actually running and the final data will be shared post the program ending. And on the other end of the scale, the TGA approved Arexvy and Abrysvo for pregnant women, adults, and older eligible adults. And it's a single dose of an RSV vaccine is recommended to protect our older people. RSV vaccine may be given at any time of the year, but where possible, it should be offered at the start of the RSV season. We were hoping that the Arexvy would be included in the National Immunisation Program for next year, but however, at this stage, it is looking unlikely, but keep fingers crossed, we can always hope. So just a couple of calculation tools that not many people actually realise are available. So the first one is your PneumoSmart tool, and there's a little picture of it there on the right-hand side of the screen. It's produced from the Immunisation Coalition, and you pop the patient details in there, whether or not they've got any comorbidities or any issues, respiratory issues, whatnot, and it will tell you whether or not they are due a dose, whether they've had a dose. It's a good little tool. So if you've not used it before, by all means jump on and have a go at that one. The COVID vaccine indicator. So that one is a very simple, do you need a COVID vaccine? Are you eligible for one? And that's on the Department of Health and Aged Care website. And then we also have referral pathways on Clinician Assist, which is our website here at WAFA. Michelle will talk you through Clinician Assist later on.
Thank you, Jodie. Just to speak to the questions in the chat, thank you so much for your questions and keep them coming. We will answer them at the end of the webinar, but please do put whatever questions you have in the chat. Now I'll hand over to Adele Hisler. So Adele's worked at WAFA for 7 years in the Healthcare Homes National Trial as the Quality Improvement Coach, and for the last 2 years as the Immunisation Primary Care Project Officer. So in her current role, Adele works with key stakeholders to assist in improving the immunisation rates across WA. She's a registered nurse with over 32 years of experience in various roles, including general practice nursing. So over to you, Adele.
Thanks, Michelle, and good evening, everyone. Thanks for joining tonight's webinar. Immunisation in pregnancy. So some infectious diseases can cause serious harm to pregnant women or even their unborn baby. Vaccination during pregnancy does not only protect the mother, but also generates antibodies that can cross the placenta, providing protection to the unborn baby and immunity that may continue for several months after birth, which is important for preventing disease. Women who are planning pregnancy, who are pregnant or breastfeeding, are therefore recommended to have their vaccination needs assessed as part of their preconception screening and to receive certain vaccines during their pregnancy. Ensure women who are planning a pregnancy are protected against vaccine preventable diseases. Check the immunisation history and give any missed vaccines. If unsure of the history of vaccination or disease, the serology can be checked. Consider vaccines, hepatitis B, measles, mumps, rubella, and varicella. Give an influenza vaccine if available, and if not already given this year, and COVID if not given in the last 12 months. Extra vaccines such as pneumococcal or meningococcal vaccines should also be considered to those medically at risk. And just to note, pregnancy should be avoided within 28 days of receiving a live vaccine. So for example, MMR or your varicella. So let's look at the recommendations during pregnancy. Recommended vaccines during pregnancy protect both the mother and the baby. Give influenza at any time during the influenza season. Give pertussis-containing vaccine early in the 3rd trimester. So back to the quiz, well done for those who got it right. Ideally 20 to 32 weeks gestation. And give COVID-19 vaccine at any stage of pregnancy every 12 months. As Julie has highlighted earlier with the RSV in older adults, at this stage, RSV vaccine is not on the immunisation schedule for pregnant women. However, it has been approved by the TGA and recommended by ATAGI. So we really are looking at next year to see what's coming along. Breastfeeding women can safely receive most vaccines. Influenza vaccine should be encouraged, if not already given, and the vaccines are available, and if the vaccines are available. COVID-19 vaccine is recommended every 12 months. And studies have shown that women who are breastfeeding a baby and have received the COVID vaccine have antibodies in their breast milk, which could protect their babies. Give any other vaccines as required and refer to the Australian Immunisation Handbook. Women who are pregnant or breastfeeding have not reported any side effects from people who are not, any different side effects from people who are not pregnant.
My name is Brooke McMahon. I'm currently working as a project officer in the COVID vaccination program team here at WAFA. I also work alongside Rachel Bretting and Jen Burns, so you may have worked with them in the past, and we work very closely with our amazing immunisation experts, Jodie and Adele, who are here today. I'm here to talk to you about the COVID primary care vaccination support program, which is now up and running. It's been alive for about 11 weeks now, and it's so far turned out to be quite successful. We're working with over 40 organisations across Western Australia. And so far we have supported roughly 50 pop-up clinics, home visits and visits to residential aged care, which has totaled in about 320 vaccinations to vulnerable people across Western Australia. We're very excited about this work that's happening right now, and it seems to be doing what it's supposed to be doing, which is wonderful. The program has also assisted us to increase engagement with residential aged care facilities across Western Australia. And we're going to help try and increase their COVID vaccination rates and address some of the barriers they're facing with COVID vaccinations. And that can include consent, sourcing a vaccinator, and providing some education. I also wanted to share some other examples of activities that we've been involved with in the program. So we recently worked with the City of Albany to help fund an event aimed at supporting those who are experiencing homelessness. The funding supported a hire of a marquee, a vaccination esky, hand sanitizer, and other essential consumables for the homeless community. The event was extremely successful, and we are doing another event with them in December. Another event that we've recently started to fund is pharmacists to attend a Baby and Children Expo in September, which is hosted by Midvale Hub in association with the Shire of Mundaring. The aim of his attendance to this event will be to provide eligible patients with the education, and if they would like a vaccination, they can get it done as well. So that looks really good, and we're looking forward to hear back from that one. We also provide reimbursements to practices that vaccinate non-Medicare card holders. So we will reimburse the cost equivalent to the COVID vaccination MBS item numbers, and there is a link on our slide there if you'd like more information. Our slide also includes the new resource poster for COVID-19 vaccinations, which has recently been released. Some NCIRS guidance on co-administration with COVID vaccination, and a resource to assist with shared decision making for women who are pregnant, breastfeeding, or planning pregnancy. We've had some really great success with our program and we'd like to continue this work. The funding is due to cease in December, so we would love to get you on board as soon as we can. If you'd like to reach out to us, the email address is on the slide, gpvaccination@waffa.org.au. So feel free to get in contact. Thank you very much, and I'll hand over to Jodie.
Okay, so has that screen's jumped over? So we just wanted, just as a final touch point, we just wanted to remind everybody about the Australian Immunisation Register and that all vaccines need to be reported to AIR either through your clinical software system or manually by accessing AIR through your Proda account. It's actually mandatory to report all national immunisation program and COVID-19 vaccinations, and has been since 2021. It's the immunisation provider's responsibility to ensure that all of their vaccines are uploaded to AIR within 10 working days after being given, ideally 24 hours, but 10 working days is the sort of cut-off point. Eligible practice patients can be searched for and recalled by a practice as a quality improvement initiative. The QI team here at WAFA is more than happy to help with implementation of a project for immunisation recall, and please reach out to your primary care navigator and or a quality improvement coach to come out and help you with all of that. And before we go to questions, I've just got one other thing I'd like to just say is that before handing over, as Michelle mentioned earlier tonight, this webinar is our 7th and final one for the series of immunisations. We've covered a lot of topics from AIR and how to access it, childhood immunisation schedule, our cold chain management, QI process, and basically the list goes on. I personally want to thank everybody who has presented, Michelle Cusack from Services Australia, Professor Paul Effler and Naomi Nelson from the Department of Health, and also various WAFA staff, including Jo, Brooke, Michelle and Emma. But mostly I want to acknowledge and thank Adele, our Primary Care Immunisation Project Officer, for all of her hard work in this space. We've created a great resource together for everyone to continue to view, and it'll be on our Immunisation Toolkit in Practice Assist.